Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy Azam campus. Today we are going to learn about antitussives and expectorants. Outcomes of today's lecture: the student will be able to define the term cough and antitussives. Student will be able to explain the act, types, causes and management of cough. Students will be able to classify the antitussives, and the last, the student will be able to explain the pharyngeal demulcents, expectorants, mucolytic agents, central cough suppressants, and adjuvant antitussive drugs. Cough is defined as protective reflux, which protects our GI mucosa and helps to expel irritant matter from the respiratory tract. This is necessary for preventing mechanical obstruction to breathing. Otherwise, it causes difficulty in breathing. To prevent this, cough reflex initiates coughing. The act of coughing involves the respiratory tract produces impulses which is carried to cough centers present in the medulla oblongata, and this area when gets stimulates initiates coughing. Coughing involves initial deep inspiration followed by forceful expiration against temporarily closed glottis. So when the glottis opens, suddenly the pulmonary air is forced through the trachea to expel out the irritant matter or foreign material present in the respiratory tract. So we'll see animation of coughing.
A typical cough involves a deep inspiration, tight closure of the glottis, quick and forceful contraction of the expiratory muscles, and then sudden opening of the glottis while the contraction of the expiratory muscles continues. High intrapulmonary pressure is generated. Once the glottis is opened, a blast of air expels foreign particles or secretions. Cough can be impaired when the glottis fails to close tightly or when respiratory muscles are weak or paralyzed, limiting inspiration and strong expiration.
The the respiratory mucosa contains cells bearing cilia, which actively transport the locally produced mucus towards the throat, from where it can be either coughed out or swallowed to keep the respiratory tract clean. Cough may be of two types. One is productive cough, that is also called as wet cough, and is associated with a large amount of sputum. And the next type is non-productive or dry cough, and in which there is no production of sputum. The causes of coughing: number 1, upper respiratory tract infection; number 2, acute lung infections; number 3, asthma; number 4, pleural diseases, where the underlying therapy will release the cough. Next, chronic pulmonary diseases like bronchitis, tuberculosis, etc., where specific treatment is required to treat the symptomatic cough. Next, secondary to acute ventricular failure, which calls for immediate attention of cardiac condition. Gastroesophageal reflux disease, drug induced coughing. So these are the certain causes of cough. Next, coming to the management of cough. Definitive treatment of cough depends upon its cause, which should be treated. If you treat the cause, the symptom as a cough will disappear. Usually, mild cough generally does not require any drug treatment. Only when cough serves as no useful purpose and causes insomnia or fatigue, then symptomatic treatment is indicated. In case of productive cough, where large amount of sputum is produced, the patient should be encouraged to cough voluntarily in appropriate posture from time to time such that sputum can be removed from respiratory tract and prevents obstruction of airflow. Many patients with cough feel comfortable after a cup of hot tea or even hot water. There is a therapy known as hydrophonic therapy in which simple steam inhalation has a substantial benefits effect in liquefying the tenacious respiratory tract secretions which prevents coughing. Next, coming to the antitussives, drugs which are used in the symptomatic treatment of cough are called as antitussives. In, in Latin, tussis means cough. That means the agents which release the cough. These drugs are used for immediate symptomatic relief of cough, and they do not serve any substitute for the specific therapy of the underlying pathological conditions that should be treated separately. If we treat the underlying cause, the therapy will be beneficial. Classification of antitussives. First class is pharyngeal demulcents. Example are lozenges, cup drops containing syrups and tinctures of glycerin, licorice, etc. Next class is expectorants, which is also called as mucokinetics. So, first is bronchial secretion enhancers. There are two types: directly acting. Examples are sodium and potassium citrate, guaifenesin, and reflexly acting, that is ammonium chloride, potassium iodide, etc. And second class is mucolytics, which make the sputum thin and less viscid. Examples are bromhexin, ambroxol. Central cough suppressants. Examples are opioids, codeine, flurocodone, hydrocodone, dextromethorphan, etc. Non-opioids, noscapine, cofridianol, and certain antihistaminics like chlorpheniramine, diphenhydramine, promethazine. And the last, adjuvant antitussives. That's all. They will act peripherally. Examples are bronchodilators like salbutamol, terbutaline, and local anesthetics like benzonatate and nebulized lignocaine. So this is the classification of antitussives. First, we'll go one by one. Pharyngeal demulcents. Demulcents are mainly useful if there is a cough due to irritation of pharyngeal mucosa above the epiglottis, that is also called as upper respiratory tract. They are administered generally in the form of lozenges, stalks, cup drops, or linters. So you can see the image. The area above the epiglottis is called as upper respiratory tract, where in which these pharyngeal demulcents may act and protects the mucosa and give relief from coughing. So what they will do, these pharyngeal demulcents will soothe and protect the throat by increasing the flow of saliva and reduce afferent impulses that are arising from inflamed or irritated pharyngeal mucosa, thus provides symptomatic relief in dry cough arising from the throat. Salivary secretions can be increased by such simple methods like by using few lemon drops, candy sugar, glycereza, or drops of lemon juice in a syrupy base. So all these secretion drugs will increases the salivary secretions, which will produce demulcent effect or protective and soothing effect. Costly preparations like lozenges, tox containing multiple ingredients such as menthol and antiseptics are usually unnecessary and wasteful. Expectorants. Expectorants are mucokinetics, are drugs that will increases bronchial secretions or reduce its viscosity, facilitating its removal by coughing. When the irritant or the mucus is removed, and there will be stop of coughing. The Latin word expectorants means to dry from the chest, to dry away the sputum from the chest. Expectorants can stimulate the output of respiratory tract fluid either directly or reflexively. The reflexively acting expectorants are also called as reflux expectorants. Certain drug may have both actions, that means they will act directly as well as reflexively. Direct stimulants, what they will do when administered orally or inhalation with steam, they will increase the respiratory tract secretions probably by directly on the respiratory mucosa and increases or expel away the sputum. That is, they will become make the sputum less viscid, that can be easily removed. Examples of these type of drugs are eucalyptus oil, anise, and lemon. Reflexly acting expectorants, they act by stimulating the gastric reflexes, which helps to increase the respiratory secretions. They produce mild irritation of the respiratory mucosa and may produce nausea and sometimes vomiting. So when we take emetic drugs in subemetic doses, they increases the bronchial secretions and produces a less tenacious sputum and easy to expectorate. Certain salts which produce such an action are called as saline expectorants. Mucolytic agents, as we name, muco means mucus, lytic means breaking down. So these drugs may make the sputum thin and less viscid so that it can be easily expectorated or removed from the respiratory tract. We'll see an animation of mucolytic agents.
During normal respiration, air travels through the nose, down the trachea, and into smaller and smaller airways called bronchi. The lining of the respiratory tract is covered with mucous membranes, which secrete a sticky fluid called mucus. Mucus cleans and protects the air passages by trapping bacteria and debris. Mucus also keeps the air passages moist and lubricated. People who have chronic respiratory ailments, such as COPD or asthma, can have an increased buildup of mucus. When the mucus builds up, debris can no longer be removed, causing difficulty breathing. Mucolytic drugs help loosen and thin the mucus. Certain mucolytic agents contain a chemical that enhances the body's own production of an enzyme called glutathione. Glutathione helps break down thick, sticky mucus. Once the mucus is thin, it is then easier to cough up or suction from the airway, improving the patient's breathing. Mucolytic drugs can be taken with a nebulizer.
So next drugs are central cough suppressants. As the name indicates, they will act in central nervous system and suppress the cough. These drugs inhibits the cough reflex complex by directly or indirectly acting on the cough centers, which are present in medulla oblongata and useful in symptomatic relief of dry irritant cough. We should not use these drugs in wet cough, since If we use these drugs, it will block the respiratory tract and there will be difficulty in breathing. Hence, these drugs are used for dry, irritant cough. Cough suppressants should not generally be used in patients with productive cough, or especially if they are elderly, not fully alert, or neurological impaired. So, this is medulla oblongata. Here we can see the impulses will go to the respiratory centers. From respiratory centers, the impulses will pass on to the muscles like external intercostal muscles and diaphragm, which helps in coughing. However, in general, cough suppressants do not impair voluntary coughing to clear secretions, and cough suppressants are not recommended in young children and children below 1 year age. Side effects of these agents are: benzonatate may cause dizziness, headache, sedation. Dextromethorphan may cause dizziness, drowsiness, nausea. Opioids may cause sedation, nausea, vomiting, constipation, lightheadedness, etc. And the last class, that is adjuvant antitussives. Normally they act peripherally. Cough may be only symptom if bronchial hyperresponsiveness, including asthma. Bronchodilators are useful in these cases as bronchospasm exaggerates and may even initiates coughing. So most marketed preparations may contains cough syrups which has a central cough suppressant, an expectorant, an antihistaminic, a bronchodilator, and pleasantly flavored syrupy base. What we have learned today: cough is a protective reflex which helps to remove the irritant matter from respiratory tract. Cough is of two types: productive cough and non-productive or dry cough. The agents which are used in the treatment of cough is called as antitussives. Thank you.